Welcome everyone. In the last class, we have done about the mostly the mental symptoms of the tarantula. तो पिछले क्लास में हम लोग ने tarantula का जो मेनली जो mental symptoms होते हैं, किस तरह आपके क्लिनिक में आएगा, आप किस तरह से पहचानोगे, ठीक है? तो वो हम लोग ने पिछले tarantula के वीडियो में हम लोग ने पढ़ा था. So today we will do basically the physical part, and along with the physicals general. We also get somehow the proving or the poisoning symptoms of the tarantula. ठीक है? So let's move to that. So क्या होता है हमें बेसिकली जो tarantula यहाँ पर बताया गया है कि in case of like in Farrington Materia Medica, it was said that suppose a person if he is bitten by the tarantula, ठीक है? Now suppose he is moving and if he is bitten by the tarantula, there are some symptoms when the tarantula bites. So what are the symptoms? Number one, there swollen and discoloration. So basically the affected part, it becomes swell and there is a discoloration, and mostly the discoloration will be the bluish discoloration. Okay, जो एरिया जिस जगह पे टैरेंटुला स्पाइडर डंग मारता है, ओके, बाइट करता है, so that area turns into the bluish. Okay, and also the area swelled and there is an enlargement of lymphatic glands. Okay, lymphatic glands, it get enlarged. Afterward, the person who was bitten, there was a feeling of or sensation of choking. Okay, choking of the throat. So difficulty in deglutition and also in respiration also become difficult and started, and after that there is an epistaxis. So there is a discharge of the dark clots. Remember, this is a poisonic symptoms. Okay, this has been seen whenever a tarantula spider bites a person. The affected part, it become somehow bluish in color. It become first in swell, and there is a discoloration. That is bluish discoloration. Then the lymphatic glands enlarged. Lymphatic gland बड़े हो जाते हैं. Okay, that lymph nodes become enlarged because of this lymphatic drainage. And then there is a symptoms of choking of the throat. Obviously, if there is a choking, there is a difficulty in deglutition and also difficulty in respiration. Then the epistaxis start. There is an epistaxis of the discharge of the dark clots, which relieved most of these symptoms. Okay, so you will see that that tarantula, it is similar to that of the lachesis. Okay, tarantula, the most symptoms of the tarantula is similar to that of lachesis. Okay, so this is one of the important things and how to compare the between the two remedies. So in both the cases, suppose a patient comes to you with the pain of a carbuncle. Okay, एक carbuncle का केस आता है तो आप क्या देखोगे? The look of the carbuncle, ठीक है, वो देखने में कैसा है? Obviously, if there is in bluish discoloration, it will remind us of tarantula. It will remind us of lachesis. If there isn't too much burning, you can think of arsenic and anthraxinum. So burning is present in all the four remedies like arsenic, anthraxinum, tarantula, and lachesis. But bluish discoloration is most commonly found in these two remedies. Okay, and mostly in this case, if the lachesis fail, then you have to give the tarantula. Okay, because both remedies are very much similar to each other. Even there is an hemorrhagic diathesis and lachesis, discharge of the dark clots and relieved by the relief the symptom. This is also present in the lachesis also. Okay, now afterwards the patient may suffer from the headache. Okay, suffer from the severe headache. Either the headache will be hammering type of the headache, just like lachesis, or as if nail is driven. Okay, as if a nail is driven into the head, same like that of ignatia. Okay, now the face become purple, face become purple, difficulty in swelling, paralysis of the deglutition, muscles of the deglutition, and there is a burning thirst for the large quantity of cold water. So burning thirst for large quantities of cold water. Okay, large quantities of cold water. Now the stool, afterward, the stool become dark, fetid, and the urine scanty. So these are all the poisoning symptoms. Okay, urine becomes scanty. Okay, so what you will see that the first it start with the lymph node swelling, and then there is an swelling of the throat, epistaxis, and then there is an headache. Okay, so one of the symptoms come by the one after the another. Then there is an GID symptoms. Okay, so in the LNs, if you see that symptoms appear periodically. Okay, this is symptoms appear periodically, एक के बाद एक आ रहा है, ठीक है। हम्म So this is one of the important poisoning symptoms of tarantula. Now tarantula, we know that it is a very good remedy for this nervous phenomenon. Okay, we know that it is one of the restless remedy, especially it affects the spinal cord. Okay, so they are very much hypersensitive. Suppose this if this is a spinal cord, so even if anyone touches the spinal cord of tarantula is so much sensitive है, so अगर कोई टच भी करता है then it provokes the pain in the chest, also the chorea. Okay, so this is very important symptoms. There is an hyperesthesia. So what the Ellen has written, if you go into the Ellen's book of tarantula medicine, it was written as hyperesthesia. Okay, that means that is least excitement irritated. Okay, least excitement irritated, it may causes either pain in the chest or it may causes your chorea. Okay, the slightest touch along the spine provokes the pain in the chest and the cardiac region. So hyperesthesia of the spine, it either resulting into the pain in the chest or in the cardiac region, and most of this complaint is derived from the central nervous system only. Okay, so that is why this is a very good remedy for the chorea, for the trembling, and for the paralysis agitance, that is nowadays it's known as Parkinsonism. Okay, so one is this is a very good remedy for the hysteria. I already told you in my next video that tarantula they feel their sickness है, ठीक है। वो अपने sickness को ना मतलब just to crave their attention of the other people, ताकि attention उनको grab हो, so sometimes वो acting भी करते हैं। ओके, मुझे तकलीफ बहुत हो रही है। ओके, एंड देन दे स्टार्टेड टू सिकनेस को वो लोग फेइंग करते हैं, ठीक है। सो दिस इज नोन एज एन हिस्टीरिया। अब वो तभी जब अकेले होते हैं देन देर इज नो मैनिफेस्टेशन ऑफ दिस प्रॉब्लम्स है, बट इफ देर इज एनीबडी अराउंड देन दे स्टार्टेड टू their sickness, feeling their sickness. Okay, so or you can say that they act their sickness such a way that small complaint looks like a big, छोटी सी भी complaint को इतना बड़ा चढ़ा के वो दिखाते हैं just to grab the attention of the other people. So this is one of form of the hysteria. So अभी थोड़े थोड़े hysteria के remedies, for example we know that in case of if you see the tarantula patient, because there are the very much restless and they cannot they could not keep quiet in any position, बहुत restless remedy होती है, so always they move their hand. So there is a rubric that mind, in the chapter mind gestures makes. Okay, so patient keep the hand in a constant motion. Okay, patient keep his hand in constant motion. So what you will see that constant motions, obviously go to the mind chapter, gestures makes, okay, and see what are the remedies are there. And you have to read all the remedies because they are very much similar to that of the others. So tarantula में से है एक mind gestures makes. So if you see in old book, it was written that tarantula is a very good remedy for the paralysis paralysis agitans. So paralysis agitans nowadays we call it as a Parkinsonism. Okay. अगर आप जब बुक्स पढ़ोगे मेडिसिन के बुक्स देयर इज रोलिंग ट्रेमर, ठीक है, okay, and there is a rolling tremor. So this is one of the feature of a tarantula. मैंने कहा ना that they're always in a hand. The patient keeps the constant motion. This is one of the motions only. Okay, involuntary motions. Okay, and there is another symptoms that twitching. Okay, twitching. कुछ भी ट्विचिंग कर सकता है. सपोज आपके पास पेशेंट आता है, डॉक्टर मेरी ने आंख ना कभी कभी फड़कती है, पता नहीं समझ में नहीं आता, पर मुझे लगता है कि आंख कभी कभी ट्विच करती है, मेरे मसल्स ना देखिए ट्विच कर रहे हैं. सो दिस इज योर ट्विचिंग ऑफ द मसल्स. Twitching of the muscles, twitching of the one group of these muscles, like suppose eye. Okay, and if there is a twitching of these muscles, twitching of the faces, we can think of agaricus. Agaricus, twitching of the muscles of the eyes, twitching of this muscles of any part of the body, twitching of this like facial twitching. Nash has written one of the good drug for the face twitching is the mygale. Okay, it is also a remedy which is made up from the spider. Okay, remember. So where you will find this, you will find in the particular, for example, अगर आप face में देखते हो तो face के twitching में जाओ in Kent repertory, or generalities के twitching में भी you will get the same thing. Okay. Now come to the headache. We already told you the headache of the tarantula is like that of an hammering headache, or also that is general, or there is an some nail is driven the head. Okay, so these are the two symptoms similar to that of ignatia. Now in tarantula, it is also has very good action in the genitourinary troubles. Okay, so Dr. Tyler has used this remedy in case of cystitis. When the cystitis, along with there is an increased rise of a high temperature. Okay, so there is an uterine pain also along with that of the headache. In case of the female, it has used in the intolerable pruritus vulva. So intolerable itching of the vulva. Okay, so intolerable itching of the vulva. Okay, so what you will see, suppose अगर आपके पास कोई patient आता है only the itching लेके, okay, so he comes to you, a female patient comes to you with this itching in the vagina. Okay, so what, or in the vulva, what urobric you will get in this. So let me write it here. Yes, 1 minute. Let me remove this. Yeah. So what is the, in which chapter you will see? We will see in the genitalia female. The chapter will be the genitalia female. The rubric is itching. Okay, itching, and then itching of the vagina. Okay, the itching of the vagina. Genitalia females itching in the night, or the itching of the vagina. Now come to the another one. There is an sore, bruised feeling all over the body. You will also found in the tarantula. But this sore, bruised feeling is one of the main feature of arnica. In arnica, the bed is very hard. That is why sore, bruised feeling. And in also baptasia, also sore, bruised feeling. But there is an offensiveness of the discharges. But in both the cases, restlessness is not present, which is too much marked in the tarantula. Okay? So bruised feeling, sore bruised feeling all over the body is also a feature of tarantula. It is also seen in the arnica, but arnica, the affected part, that affected like where he's lying, it seems like very hard. That is why he wanted to change. That is why he's restless. He wanted to change the bed. because seems like that the bed is very hard. In case of opium also, but there the in case of opium the bed looks like seems like very hot. ठीक है, ओपियम को भी लगता है कि बेड बहुत लाइक फोर ब्रूस्ड फीलिंग होता है, बट उसको लगता है कि बेड बहुत गर्म है. ठीक है, in bacteria is also have the sore bruised feeling, but the discharges are very much offensive. Whatever the discharges, whether it is urine and stool, they are very much offensive. So I'm telling you basically comparative Medica and also how to apply it in your clinic. Okay, so there is a restlessness is also marked in the Tarentula, which is not that much marked in the Arnica and the Bacteria. Okay, so there is another very good remedy for the hysteria, which we known as your Crocus sativus. Okay, so in the Crocus sativus is also a very good remedy for the hysteria or in the case of chorea. But here the patient is always the reason laughing alternate with sadness. Okay, and there is a desire to kiss everybody. Okay, desire to kiss everybody. Dancing is also there and desire to kiss everybody. And also music affects just like Tarantula, music affects her, and hearing only the a song should begin to join, same as like that of the Tarantula. Okay, but Tarantula जैसे foxy होती है, cunning होता है, so Crocus is not like that. सिमिलर फीचर्स आर लाइक टेरेंटुला कि म्यूजिक सुनते भी उनको भी लगता है कि मैं भी डांस करना शुरू कर दूं. Laughing alternating with sadness, loquacious is also present in the crocus just like a tarantula. There is another remedy when you will see about the chorea, that is Actia racemosa. Okay, so Actia racemosa, basically the chorea is due to the reflex symptoms of the uterus. Okay, and there is a sleepless, restlessness, trembling, all are present. And remember, in this case, jerking start after going to the bed, come on the side which is lying. So in the Actia racemosa, the trembling usually occurs after going to the bed on the side the patient is lying. Okay, so जिस साइड में सोता है उस साइड में बेसिकली जर्किंग स्टार्ट हो जाते हैं, विच इज अ फीचर ऑफ एक्टिया रेसमोसा. ओके, बट इफ यू सी इन केस ऑफ एगारिकस, एगारिकस का जो कोरिया होता है इट नेवर ऑकर एट द नाइट टाइम. रिमेंबर, द कोरिया ऑफ द एगारिकस नेवर ऑकर्स एट द नाइट टाइम. ठीक है, एगारिकस का जो कोरिया होता है ट्रेम्बलिंग, इट नेवर occurs at the night, whereas in case of your Actia racemosa the trembling is of the jerking start when the patient is going to sleep, especially on the part start especially on that part which the person is lying, on the side which he is lying. Okay, so where you will find this rubric in the Kent repertory, please go to the page number 1370 of Generalities chapter. You will get this rubric, the name jerking of the muscles, the side laying on. Okay. So this you will find in the page number 1370. Okay. Now come to the another remedy, that is your hyoscyamus. Hyoscyamus is also have that local jerking is there, but yes, they are very much suspicious and the shameless, just like tarantula also, but the degree is higher. And restlessness is present, but the degree is lesser than that of a tarantula. Okay. Now come to the another remedy which is very important, that is causticum. But in causticum you will get the other generalities of the causticum. Okay. So In causticum, basically we see that the restlessness is there, but restlessness is mostly marked in the lower limbs, okay, especially in the limbs, especially in the lower limb, just like that of a zincum metallicum. But the causticum, the chorea or the trembling or the conversion, all there is a history of repercussed eruptions. Okay, the eruptions are there, but they get suppressed because of some reason. But in case of zincum metallicum, the eruptions is not able to come out. वो आ ही नहीं सकता, ठीक है। जैसे कॉस्टिकम में इरप्शंस सप्रेस्ड हो जाते हैं, जस्ट लाइक दैट ऑफ क्यूप्रम मेटालिकम। ओके, सिमिलरली इन केस ऑफ जिंकम मेटालिकम इरप्शन सही से बाहर ही नहीं होता। बच्चे को चिकन पॉक्स आया है या तो मीजल्स आएंगे, बट इरप्शंस नहीं आ पा रहे हैं बिकॉज ऑफ दिस लैक ऑफ वाइटलिटी in the child. Okay, the vital force is not able to help in the eruptions, to came out from to help the body to get rid of the eruptions to come out from the body, ठीक है। it is because of the lack of the vitality. But in case of the causticum, eruptions बाहर आ गए हैं, but because it gets suppressed because of some ointment or some reason, and then the complaint started. तो इनकी जो कंप्लेन है दैट इज सेम थिंग, रेस्टलेसनेस मोस्टली मार्क्ड इन द इवनिंग। बट इनका जो होता है ना, एंजाइटी इज वेरी मच प्रिवेल, ओके। सैडनेस वो तो बाद में आता है, बट एंजाइटी इज टू मच, एंड एंजाइटी इज मोस्टली एग्रीवेटेड इन द इवनिंग, शाम के समय ही डॉक्टर। सुबह को तो मैं, और जैसे ही शाम होता है ना, मुझे घबराहट शुरू हो जाती है, ठीक है। ये आपको पेशेंट आके बोले, या तो कभी कभी आपको पूछना भी पड़ेगा, ये एंजाइटी आपको हर समय रहता है क्या, या कोई पर्टिकुलर टाइम ऐसा लगता है कि शाम के जब अकेले रहते हैं, या जब इस तरह से, इस आपको पूछना पड़ेगा। यू हैव टू टेक आउट द सिम्टम्स फ्रॉम द पेशेंट, ओके। सो एंजाइटी एग्रीवेटेड इन द इवनिंग, or suppose if she goes to the blood, okay, if she goes to the blood and then she want to sleep but she is not going to get sleep, और या तो एक बार नींद टूट जाती है and then फिर आना नहीं चाहता, ठीक है। these are some general symptoms you will find, wakes up from the short sleep and then not able to go to the sleep, and इसकी तो जर्किंग होती है, द मोस्ट जर्किंग स्पेशली ऑन द राइट साइड, जरूरी नहीं है एवरी टाइम, बट मोस्ट कॉमनली इट इज सीन इन द right side. And also the causticum patient, they suffer from one or some of the rheumatism, okay, who suffer from the rheumatism or some paralytic affections, okay. Now these are all about your, about the causticum. In case of how will it differentiate with that of the tarantula, बहुत इजी है। कॉस्टिकम भी रेस्टलेस है, टेरेंटुला भी रेस्टलेस है, बट टेरेंटुला में एंजाइटी उतनी होती नहीं है, बट कॉस्टिकम में एंजाइटी के लिए उनको रेस्टलेस होता है। एंजाइटी मोस्टली इन द इवनिंग को, बहुत ज़्यादा इवनिंग को ही, जैसे ही इवनिंग होता है तो उसकी रेस्टलेसनेस और एंजाइटी बढ़ती रहती है। एंड ओनली कॉस्टिकम पेशेंट को आप देखोगे, दे माइट हैव सफर फ्रॉम एनी टाइप ऑफ द स्किन eruptions in the history which get suppressed, or there is some paralytic or some rheumatism affecting the patient, some type of the rheumatism, ठीक है। Now come to the another remedy, which is your ignatia. It is one of the good remedy for the chorea or the hysteria, ठीक है। And we know that in ignatia the ailment will be the different, ailment here is a different, okay। We know that ignatia is extremely sensitive person, कोई भी उसे कुछ बोल देता है तो मैं दिल में लगा लेती हूँ, मुझे बहुत खराब लगता है, पर मैं किसी को नहीं बोलती हूँ, अपने आप में ही रखती हूँ। फिर मुझे दुख होता है और उसके बारे में सोचती रहती हूँ, एंड देन एलिमेंट डेवलप होते हैं। सो दिस इज इग्नेशिया। एंड अगर मुझे उस समय कोई आता है सहानुभूति देने के लिए, तो मुझे बिल्कुल इच्छा नहीं, मुझे किसी की जरूरत नहीं है। सो कॉन्सोलेशन एग्रावेशन, ओके। एंड इवन इट इज ऑल्सो दैट इज contradiction aggravation, even it is a very much contradictory remedy also। contradiction aggravation is also there, and consolation aggravation, consolation से relief नहीं होता है। आपको पूछना पड़ेगा कि सपोज आपको गुस्सा आ जाता है, या कभी आपको कोई अगर मनाने आता है कि नहीं ठीक है तभी मान जाते हैं, या थोड़ा टाइम लेते हैं। पेशेंट बोलते नहीं, जब मुझे मानना पड़ता है तभी मानूंगा, मैं नहीं सुनना चाहता। सो दिस इज योर consolation aggravation. So you have to ask in this way. So here the ignitia, all type of the complaint, whether it is poria, hysteria, it is mainly due to some ailment from the disappointment. Okay, ailment from the disappointment, or there is some failure. Okay, or if there is some humiliation. Okay, so these are the and because of this they goes into the grief, they grow into the grief and they develop fear. Whereas in the tarantula, the same thing, if it has happened in the tarantula, they goes into the rage. Okay, they goes into the rage and the violence. So see, the reactions of the two persons are different. One is going into the inward grief, and other is started to rage and going to the violence. And other ignition, they keep their trouble in their themselves, and afterward there will be a frequent sighing. Okay, frequent sighing is there in the like गहरी गहरी सांस लेने को मन करता है, ग्लोबस हिस्टेरिकस, ऐसा लगता है गले में कुछ है, लंप है, ठीक है, and they mostly due to the disappointed love, and here the tarantula is due to the unrequited requited love. Okay, that means a one sided love. मुझे जिससे उसके साथ प्यार मिलना चाहिए था, उसने मुझे वैसा प्यार नहीं दिया, ठीक है, उसको देना चाहिए था, सीधी सेल्फिशनेस ओवर देयर, उसको देना चाहिए था, so it is one sided less, and then there is a rage, and that person also kill, also strike, also no mind striking himself or striking others, that rubric is there, ठीक है. So there is a no return of the affection, that is unrequited love is the ailment developed resulting in the tarantula ailment. So whenever you read the Pathak repertory, ना उन्होंने एक ही रेमेडी दिया है unrequited love में, and which is very prominent piece है tarantula. Also the ignitia is very much changeable mood. They live and they laugh, they cry, then joke, they again cry. They are very much tearful. Okay, थोड़ा सा भी होता है तो आंखों में आंसू आ जाते हैं. Headache is also similar to tarantula, as if nail is driven into the head. ठीक है, and remember in ignitia, headache is relieved from the profuse urination. बहुत urination होगा, which is not present in tarantula. In tarantula same headache is present, the intensity is same, but ignatia character is different. He keep things in himself, or the tarantula they go into the rage, and also they are very much cunning and attempt to feign their paroxysms. Okay, हेडेक अभी नहीं है, पर जैसे यहाँ के मुझे शुरू हो गया दर्द, तो इस तरह के वो लोग स्विंग सिकनेस में आते हैं. ठीक है, ऑब्वियसली आई टोल्ड यू द टैरेंटुला म्यूजिक को बहुत पसंद करता है, उससे म्यूजिक एग्रीवेट भी होता है, म्यूजिक से एमुलरेशन भी होता है. So headache is also aggravated from the noise, from the touch, from the strong light, but it is relieved by the rubbing the head against the pillow. ठीक है, it is only the relief is somehow different than other remedies, relieve the by the rubbing the head against the pillow. So these are all about some of this remedy about the tarantula. So some of the rubric you will get there, that is constant motions of the leg, arm, track with inability to do anything. So good remedy for the paralysis agitans, and what you will see, that is mind gestures wringing the hand. Okay. So hyperesthesia, least excitement, slight irritation, followed by the languid sadness. So this languid sadness, this is also feature of ignatia, but I told you the character of both the person should be different. So what is the rubric? Generalities, irritability, excessive irritability. थोड़ा सा भी टच किया तो प्रॉब्लम शुरू हो जाता है. हाइपरेस्थेशिया और एक्सेसिव इरिटेबिलिटी, jerking of the muscles, and then the jerking of the muscle, the patient is going into the lassitude, then the sadness, doesn't want to do anything, so generality is lassitude, and the lie down inclination too. ठीक है, तब देखो कि एक के बाद एक भी symptoms आते जा रहे हैं, that is symptoms appear periodically. ठीक है, So इनका और एक symptoms है in female reproductive symptoms में that at every menses their throat, tongue in their intolerably dry when sleeping, which is also a feature of nux moschata. Okay, so nux moschata में भी है that is in during the menses their like throat become dry, mouth become dry, and tongue is also drying. Okay, so anything. So this is all about your tarantula.